Namaskar, hello and welcome to the special broadcast on Sansad TV. I am NAMRATA Singh. Mental health is a vital part of overall well-being, yet it often doesn't get the attention it deserves. In today's fast-paced world, mental health has become a buzzword, dominating social media and everyday conversations across the globe. But mental health is more than just mental illness. It includes stress, anxiety and depression that even those with life-threatening or terminal illness experience. India, with its massive population, faces unique challenges in addressing mental health. In fact, for the first time, the Economic Survey 2023-24 highlighted mental health, recognizing its crucial role in both personal and national development. On this show, we will analyze the essentials of maintaining mental well-being and why it is critical for a healthier and happier life. To discuss this and more, I'm joined by a very distinguished panel of guests. Please welcome Dr. Puneet Gupta, oncologist and author of the book Applied Spiritual Biology. I'm also delighted to welcome Dr. Sudha Goyal, senior consultant at Niti Aayog. Thank you to both of you for joining me here on this program. Dr. Gupta, I'd like to begin this discussion with you. You know, when I was preparing for this show, I came across the title of your book, which is Applied Spiritual Biology. So I would like to understand from you, what exactly is spiritual biology?
Yes, spiritual biology is a very modern domain where we must essentially focus on our spiritual well-being, because you know, human personality is a plethora of 5 dimensions. So we have physical, mental, social, spiritual and economical well-being. So what the problem I was facing, that with my cancer patient there was a unmet need that nobody was actually asking them for their active participation. If the surgical oncologist is there, he is operating upon the patient, but there is no, or we are applying some devices onto the patient, or we are asking them to give some anti-cancer medicines, but what actually their own participation in their own healing. Then I understood the power of what I call as the dimension which we were totally missing in the what I call as the total integrated human wellness is the spiritual biology, because 25 years of my research has shown that there is the inbred human biological biofeedback system which actually integrates our mental health, and especially 3 components are very, very important. The what I call as DESU model. DESU means it is the dream center, the survival center of the brain and the emotional brain. So DESU. So dream brain, emotional brain and the SU is the survival brain. So these 3 parts of the brain, when they integrate and interplay, we have to train them so that they give us what I call as the optimal result of our spiritual well-being.
Right. So Dr. Goyal, Mental Health Day was first observed in 1992 and it's been over 3 decades. But still, whenever we talk about mental health, in fact, it isn't taken that seriously the way it should have been. So what, according to you, is the state of mental health in today's context and why it is important?
Thank you, Namrata, for having me on the panel. And I appreciate this opportunity to talk on the very important subject of mental health, which has become a major public health concern today.
Right.
So I would begin your answer by saying that there is no health without mental health, which emphasizes that mental health is integral to the overall well-being. And also, it is important that we take care of our mental health in all aspects. Right? The fundamental of collective and individual ability to think, emote, interact with each other, to earn a living and enjoy life, we need to have mental health. Right? So I would explain this in a simpler way by defining mental health. Mental health is a state of overall well-being in which an individual has the ability to realize his capabilities, to realize his potential. He is able to cope with the stresses of life. He is able to work productively and also contribute significantly to the society. So this is all about mental health. But how to differentiate mental health from mental disorders? All those conditions which affect the emotional, psychological and behavioral aspects of an individual and also make significant changes which enable or which disable him to think properly, interact or behave in a normal way. And it also includes the stress, extreme distress, also the problems related to work in society or at family or at his workplace. All those conditions contribute to mental illnesses. Now, mental illness patient will present with some of the symptoms which are probably related to his illness or may be seen by a doctor to classify in different categories. The patient may come up with emotional symptoms, he may come up with cognitive symptoms, or he may come up with behavioral symptoms. The emotional symptoms, he will be having persistent sadness, anxiety disorders, panic disorders, or cognitive thinking may be deranged. Probably he may have difficulty in concentrating, memory disorders. The behavioral symptoms will include like withdrawal from the family members, from the friends, so or difficulty in sleeping or eating habits may change, or physical symptoms, unexplained aches or pains. He may come up with headache which doesn't have any pathological reasons to be there. So all these conditions come under.
Basically, there is no disease, but the patient feel like that I'm suffering from some illnesses. That I have pain, even if they don't have psychological.
That would be one reason for this.
Right.
Though then definitely we need to classify the mental health illnesses into two categories. There are common illnesses and then severe illnesses. The common mental illnesses are those which are not very significant and can be managed with therapy or by changing the lifestyles. Whereas the severe ones, they need intense treatment. So overall, nutshell, we can say that the overall well-being depends on understanding the mental health and addressing the mental issues, so that not only the individual is helped, but there is total development of the society in per se.
Right. So, Dr. Gupta, mental health is more than just mental illness. According to, there is a research which suggests that 60% of cancer patients require mental health interventions. So, in your book, you mention about, spirituality and self-healing can be incorporated in healthcare. So, why do you believe it is important to integrate spiritual well-being with modern healthcare?
See, I will tell you a story behind this. I had a patient in, let's say we have in hospitals, we have cancer ward, then we have general medicine ward, or you can say heart cardiology patients are together, then eye patients are together, they are in a group. But initially in small hospital setups, it's not there. So one patient came and after initial checkup in the medical ward, then he was shifted to the cancer ward. And then what happened, he just started in medicine ward, there are different, somebody is having problem A, diagnosis, lung problem, liver problem, bone problem, because general medicine is a general kind of multiple organ systems are, patients are there. And now what happened in the cancer ward, everybody is having cancer. So this old man, he went inside and he said, okay, to the next bed he will ask, may I ask you what problem you have? Then he will ask next person, can you tell me what problem you have? Then every day he was asking the same question to the, whosoever is the next bed one. So one young boy came, he says, sir, why you are asking this question to everybody? You are in a cancer ward and everybody here is having cancer. And you won't believe that man slept that night and he says, can it happen? Is it possible that everybody in this room, all the 30 patients, they are having cancer only? He said, yes sir, or what is it? This is a cancer ward. You are in a cancer ward. And then that man slept and he never got up again. So this happened during my, when I was doing my internship. So this impacted me a lot as a young doctor, budding doctor. And then I started really thinking that what is the mechanism of our human body that is all, whether it is automatic, we have an autonomous nervous system, and we have other cytokines, we have other body physiology pathways. So I started thinking about embryology, electrophysiology, neuroanatomy, that how these things have happened, how this person can lose his life even by just a simple,
thought of having a life-threatening disease, which maybe he wasn't very serious.
Yes.
Yeah.
So that impacted me a lot, so I started taking it very, very seriously. So I did my research work for 25 years. Then I sat and I said, okay, all this embryology, neuroanatomy, electrophysiology, I'll put together, and I wrote a book, Spiritual Biology and Psychology.
Right.
So now what was the challenge? So how to put, because we have a busy practice as oncologists, so how to put it into the practice? So what I did, I walked into Amity University. I asked them, we want to start a diploma in psychology oncology, and then we made a course program. Then we initiated a diploma. First time in India we made a program in psychology oncology, and we trained. We are into 5th year now, and then we have now full-time psycho-oncologist with us. She sees each and every patient, and then we counsel them, and then we integrate yoga, let's say mudras. There are simple mudras. So we each and every patient we tell them mudras. So patients who are fit, we tell them the breathing exercises, stretching exercises. Then we integrate this, what we call as the cognitive interventional techniques, and this is done by a professional trained psychology oncologist.
Okay.
And I was fortunate enough, I can say, okay, I presented this data in International Cancer Congress, Hong Kong, and then in San Antonio Breast Cancer Symposium. And then I had fortune to present data recently 2 months back. We had an international cancer conference in this Maryland, Bethesda, and there I presented the data of newer 300 patients which I have seen in last 8 months, and what were their presentation. And in fact, you know, this number what you are talking 60%, it swelled up to 80%. 80% of my clients, they required psycholo-oncology support in one form or the other.
And they have been affected positively through this self-healing,
yeah,
right?
So it's I can expand on the model what we so say there is a dedicated facility and they require a dedicated experts,
right. So Dr. Goyal, I would like to understand from you, how do you view the role of self-healing in improving mental?
So Namrata, self-healing actually is all those practices which an individual takes to build his mental strength without any professional intervention. So meditation, mindfulness, eating good food, taking adequate sleep, or building strong social connections come under self-healing. Right, and the aim is to build the strength, also build social connections, and also to have an integral well-being, overall well-being is the main aim, self-healing. But self-compassion and self-awareness are also important. Self-awareness means that realizing and accepting your thoughts, your emotions and your behavior, and accordingly taking care of those areas which need attention and focus. While self-compassion is being kind to yourself, especially in difficult situations when you need to not overly be critical or over judgmental about yourself or about your behavior. So these are the things which come under self-healing. Now, if I speak about self-healing more, then as a doctor, I would advise that be positive, balance your emotions, avoid negative thinking, take good food, take care of your physical health also, develop some mechanisms to deal with stress and build strong connections. So this is all about self-healing, and this is a main component of mental health program as well.
Right, basically to be positive,
yes,
in life.
That's right.
Dr. Gupta, but what do you think that there is lacking in current healthcare system, where your concept of spiritual biology can integrate and make it better?
See, what I realized, as I told you, we have given a hardcore data. About 80% patients are going to they in the need of mental issues. So they need that addresser.
Right.
So it has to be number one, professional help is to be there, because if it is not the qualified one, because cancer patient journey is a very special one. They undergo the stages what we call as the mental health issues are described as a key word. Dr. Kubler-Ross has evolved a model. She was a British psychologist. She has been done immense work, and I follow her footsteps. We evaluate each and every patient for what we call as DAB D. So here DAB D means there is patient initially they will have interplay between their, as I told you, DESU model, dream center, emotional brain, and what we call cognitive brain, that is known as prefrontal cortex. So this prefrontal cortex brain is known as survival brain. So patient has many survival issues. There is When you suffer from cancer, we say existential crisis, whether I will suffer, well, I will die of a bad death, I will have a good death, how soon I will die, even if the patient cancer is cured, will it come back? All those survival issues are there. So these are addressed by your prefrontal cortex. Then you have another special part of the brain, what we call as the emotional brain, that contains three components, that is amygdaloid body, hippocampus and caudate nucleus.
Okay.
And then you had the third, the dream center, what we call, we have at the back of the head, this is in the pons, there is the central reticular formation that gives the input to the emotional brain and also to the prefrontal cortex. Now what happens if our system is immature and we are not addressing it properly? As I told you that patient, when I went into the biology, so biofeedback mechanisms, you know, it suppresses the prefrontal cortex, your survival ideas, they shrink, you say, oh, I may die, and you know what we call as a impending death syndrome.
Okay.
So, and second, your emotional brain also, you become emotionally jittery, unstable, you weeping start, depression start, anxiety starts, existential crisis start, whether once I will die, my spouse will remember me or not, my kids will remember me or not, will I exist for my friends or not? So these issues, they start cropping up, you know,
right.
And then you lose what we call as, you lose the self identity.
Okay.
So this fear also is addressed by these three sensors: prefrontal cortex, survival brain, your emotional brain and your dream brain. So now your dreams also changes, you know, you start seeing bad dreams, your body is being burnt, or you are being, your cancer is mutilating you, or all those your cancer is coming back. So all this so now is a plethora of all these three systems starts. So what we have to do, so this dab story, first there is a stage of what we say denial, then there is a stage of aggression, you become, anger is there, then some will have the bargaining, the next stage is of depression, anxiety and existential
right.
crisis, then is the acceptance, and last is the bereavement. So you have to now catch patients through a trained psycho-oncologist that which of these stages the patient is really having the journey right now, and then address those issues using the yoga and what we call as the cognitive interventional Gupta glitter technique.
So this has become, you know, like having that fear of that I might die because of this particular disease. So you're saying that this technique of, you know, spiritual biology, it really impacts patient and they become better after this.
Yeah. In this, how they become better now, as she was addressing it very nicely, my panelists, that we have to now give them a biofeedback tool. We have to train their emotional brain, survival brain, prefrontal cortex, and also give data to the dream center, that now our dreams should improve, our survivalship thought should improve, and our emotional content, emotional stability also should improve. So what I do, the psycho-oncologist, every day she goes to the patient practically, and we have a folder and we have some workshop things, you do play a game kind of stuff, and we have a video also where we educate that. Now in my model, very important, why we call it spiritual biology, because spiritual biology tells you, which is different than our modern science, is that the imagination, you know, mostly we think it is the cognition is the function of the prefrontal cortex, that's the brain.
Okay.
But spiritualism tell it something very different.
Right.
The seat of your soul is in your heart, you know. So when I develop into this, they say, so we say now the white light is coming, it enters your heart, we train the patient like this, cancer patient, and from the heart, now it is going into your feet, into your thighs, into your arms, into your face and neck, and now your whole body is glittering. It is, let's say, it is dazzling. It is like a, it is shining like a, let's say, glow worm. Jugnu is there.
Right.
So jugnu की तरह चमक रही है आपका शरीर.
Right.
और ये चमकदार glittering जो body है, it is 4D character, means it is diseaseless. There is no cancer you imagine. It is because survivorship brain, prefrontal cortex को हमने train करना है कि you don't fear death. So your body is dazzling. It is diseaseless, deathless, and it is deformityless. If your, let's say, breast is amputated, hand is amputated, you don't imagine, oh, my breast is amputated, my hand. You say, my body is full. It is a glittering body. It is a full blown body, whole body imagery you have to imagine. So, I am a perfect body. I am the best body. It is diseaseless, deathless, divine and dazzling. And then with that thought, you give the prefrontal cortex. You load this information to prefrontal cortex, and when you sleep, this information will go into the emotional center. It will go to the caudate node, hippocampus, amygdala body, and then it get connected the input from the dreams. So let's say dreams you were thinking that you are being burnt or this thing. Now what happened with your whole body? Wide imaging, your body, if they are burning you, you will find that you are not like Holika, you are not getting burnt. Your body, that's a spiritualist we say कि जो आत्मा है ना, ये इसको you can't neither burn nor you can wet it nor you can spoil it. It will remain as such. It will remain forever. So that survival thing will come up.
Survival instinct will come up. Like Dr. Goyal was saying that, being positive is very important.
Yeah. So this is actually the biology of being positive.
Right. Yes. So, but Dr. Goyal, according to the National Mental Health Survey in 2016, around 10.6 of adults over the age of 18 suffer from mental illnesses. So, what programs have been launched by the government in this regard to take care of the mental health care in the country?
Right, Namrata, you are right in quoting that National Mental Health Survey, which said that the prevalence of mental health is 10.6%.
Right.
In fact, the lifetime prevalence of mental illness is 13.7%. At the time of the survey, it was reported. Now, if you see the data, there are about 150 million people in India who require mental health interventions. Out of that, 12 million, that is 1.2 crores, suffer from severe mental illnesses.
Oh.
And also, the report has reported that there is a treatment gap of 70 to 90%. There is an acute shortage of psychiatrists, the trained medical health professionals. Also, there are challenges related to availability of psychotropic drugs, the availability of psychiatric beds in the district hospitals. So, all these challenges are there. But there are concerted efforts from the side of the government to take care of all those things. India was, in fact, one of the first countries amongst the South Asian countries to launch a dedicated program for mental health. Our mental health journey started in 1980s. In 1982, we launched the National Mental Health Program. The aim was to reduce the burden of mental illnesses and also to address the challenges related to manpower.
Okay.
And the availability of minimal services for the vulnerable and marginalized population, underserved areas of the country, that was the aim. Also, community participation, availability of resources, training of the manpower, these were the main objectives of the program. After that, in 1996, District Mental Health Program, which is the implementation arm of the program, was launched so as to detect the disease early, the symptoms early. Early detection and treatment was the main aim. Also, training of the general health physicians, the medical officers who are posted at the PHC, the primary health centers, or the CH, the community health centers, was the main aim. So that to empower them to detect the disease early. The community participation to reduce the stigma around the disease, these were the objectives of the District Mental Health Program, which is running as of now in more than 90% of the districts of India. Also, this is implemented through a team of psychiatrists, clinical psychologists, psychiatric social worker, psychiatric nurse, along with the support staff. After that, in 2022, in October, we started with Telemanas, that is tele mental health assistance and networking across states. This was a big initiative so as to reach to the remote and underserved areas, get them connected through a telecall. The caller will make a call, and this is implemented through 2 tiers. In tier 1, one counselor will take the call, and in case needed, he will provide the counseling. In case needed, he will connect the caller to the specialist also. In tier 2, the specialist will be available at district mental health cell and also at the medical colleges. So the person or the caller can meet him personally also, and through the call also can get connected. So these are the initiatives which have been taken in the program. Along with that, Ayushman Bharat is one of the initiatives which has expanded our services, because now the services are closer to the community. The community health officer who is posted in the Ayushman Bharat Arogya Mandir, he is in a position to detect the disease early, and in case more care is required, he will link that patient to the next level of care. Along with that, for the adolescent, there is RKSK, Rashtriya Kishore Swasthya Karyakram, which takes care of the adolescents' mental health care. Also, in schools also, there is a program, School Health and Wellness Program, which also is taking care of the mental health of students. Training the teachers, to detect the symptoms in the students and conducting the campaigns. These are the initiatives which have been taken in the program to take care of the mental health.
So early detection is very important. Dr. Gupta, in your book, you have explained the role of body imagery in promoting the mental health and staying fit. Are there any specific techniques patients can use?
Yeah, it is what we are doing now. Actually, in fact, we are integrating, a plethora of techniques. Here, we are using what we say. This is a technique of mindfulness, and then there is a technique of in yogic mudras are there, and we are dealing them. If I give you example, practical example, how we are doing, we are integrating them stepwise. Let the patient who is in the denial phase. So there we find the technique of mindfulness and mudras and let's say breathing, alom vilom, and those exercises are more helpful. If the patient is in a stage of aggression or anger, then we encourage active yogic exercises, vinyasa, and to release the pent up energy and anger, and practice alternate nostril breathing, what we call as the nadi shodhan.
Right.
So those we have integrated with the daily counseling, and initially that, as I told you, the whole body imagery technique of the Gupta glittering therapy, that you have a glittering body and it has a 4D character of diseaseless, deathless, deformityless, and the despairless body. Let's say in the stage of bargaining, we guide the patient through gratitude meditation and to reframe their outlook, and also build up self-confidence and hope. And in the patient with depression, anxiety or existential crisis, we try to focus on let's say restorative yoga and breathing exercise to uplift the mood. In the phase of acceptance, we try to use the group yoga, where you call all the family members of all the patients, and then do the group practices, group mudras, group yoga, and group breathing exercises, because now they have accepted and they are open for the social commitment. Then in the last stage of bereavement, we use guided visualization to find the closure and peace. So we move these stages wise, and now my next paper will be, actually we are working with the yoga experts now. So instead of a psycho-oncologist, now we have a full-time yoga expert, where we will integrate that which kind of, some of the cancers, if we cannot do let's say breathing exercises, they may harm the patient. Let's say a lung cancer patient who is having bleeding, and if the hemopsis is there, at that point of time we don't encourage the breathing exercises, so it's a contraindication. So we are making a kind of a checklist now, that which yogic practices we should be integrating with a defined situation of cancer patients, and we are, after implementing, then I will be publishing this integrated work further.
Right. So it's time for the closing comments from both my guests. So Dr. Goyal, you go first. How do you think we can achieve better health on a personal and societal level?
Okay. Thank you, Namrata, for putting this question, because mental health is a very complex issue. It cannot be dealt only by the program. The changes in the society is also required, because there are issues related to stigma, there are issues related to personal barriers, the lack of education and awareness about the program, which prevents a person to take the treatment. Even if the treatment is available, there is hesitation to approach the facility. So these are the changes which we have to bring in the program through extensive IEC activities, which we are doing as of now also, but there is need to increase more of education about mental health. So otherwise the program is doing good in making good efforts, concerted efforts. We are increasing our manpower. We are starting with the training of all CHOs also. So many good initiatives are there in the program, but also a change in the society perspective is required. Thank you.
Definitely. Dr. Gupta, your closing comments?
I think now it is the time for India to lead what I call the upfront mental wellness by integrating spiritual wellness into the modern healthcare practices, treatment protocols, and integrate yoga along with the whole body imagery techniques, which are based on very good spiritual biology, and come out as a leader in integrated spiritual biology practices along with the modern healthcare system.
So education and sensitization can help change people's mindset, India is improving mental health care through policies and programs to reduce treatment gaps. Working together and removing stigma is key to making care accessible and recognizing mental health as a right. Thank you, Dr. Goyal and Dr. Gupta, for your time. Well, on that note, it's a wrap on this program. Thank you for watching Sansad TV.